Hey, good afternoon, everybody, and welcome to the annual update. Today, we're lucky to have Kelly Posner. She's going to talk to us about the Columbia Suicide Severity Rating Scale that's developed here. When I was in the Bronx, I was trying to get her to come speak to us for the longest time, and now that we're here, we're lucky that she's agreed to come and speak to her fellow employees. Also, the EAP is going to make some announcements. I'll talk to you guys about all those wonderful PDFs that we send you every year. And then Alicia Carreau is going to talk to you guys about infection control. And we'll play a video that Chris Stanley did for cybersecurity here at NISB specifically. And then the chief will talk to you guys about safety and security. Pete Reynolds is going to talk to you about emergency management. And then Matthias Quick is going to talk to you guys about lab safety and the right to know. So first up, Kelly just got the Secretary of Defense's award for medal for exceptional public service, and as well as doing her outreach and work for the military and our police and firemen. And again, we're lucky to have her.
I actually couldn't be more excited to be doing this with my own colleagues. So. Most of you are probably familiar, many of you, with the Columbia, but as part of your job, right? What you may not be aware of is that it's really a vital part of wellness, health and wellness for employees and their families. So let me back up for a second and start with the good news. Suicide is preventable, but it is the tragic paradox that takes more firemen than fire, more police than crime, more soldiers than combat, more lives than car accidents. And it touches 135 people are affected by every death, and these effects linger across generations because of that silence that often follows. And what is amazing is how it really touches everybody. As I said, #1 cause of death among police, firemen. Did you know that if you take a large corporation of 100,000 employees, every 6 days, an employee or a family member will die by suicide? Every single day, there will be 3 suicide attempts. So what we know is that we really have to protect the protectors and care for the caretakers. We've read each week a leading voice who's a clergy for mental health kills himself. The head of a major university of mental health, the head of mental health kills himself. It just keeps coming back to us that we must focus much more on this. And I want to say, so when police use the Columbia, they're not only using it in their day job, they're using it to save their own lives. Ask your fellow officer, care for your fellow officer. So if you work at Wells Fargo or the Canadian Border Patrol or now the United States Border Patrol, you will be getting these questions. And I just have to tell you a story. Well, I went to give a talk at Sloan Kettering because in medicine, it's like blood pressure. But the head of nursing came up to me and said, I use this to save my son's life. And we hear that 1,000 times over. So I just point to employees and their families, right? So we know that 50% of people who die by suicide have seen their primary care doctor the month before they die. We should be asking these questions the way we monitor for blood pressure. Did you know that many adolescents who show up to the emergency department who've tried to take their own lives are not there for psychiatric reasons? So if we're not asking everybody like we do vision testing, we're not going to find the people suffering in silence. But what we know is that must be well beyond the doctor's office. So I imagine, it's the #1 cause of death in construction workers. So I hope soon enough that when construction workers have their safety checks in the morning, it's not just going to be their hard hats, it's going to be the Columbia questions. I just went to Major League Baseball. In the locker room, when people, because you know what? Many people won't ever get to the doctor. So this is the importance of knowing we must go find people where they work, live, and thrive. So the Undersecretary of Defense's office wrote this urgent memo that we must go beyond the doctor's office with these questions because most people won't have the will to come to you when they're suffering. And so why have people not wanted to ask in the past? Well, first of all, they didn't know if it was going to cause distress. We know the opposite, actually, that when people are suffering, they want help, and it actually relieves distress. The other thing is people were worried about liability. We don't have a perfect formula. We may never have a perfect formula, so people used to say, how can I ask? So the good news is the Columbia has so much science behind it, 120 studies in the evidence book, 1,000 that reference it. It gets rid of that worry about liability. So people say you don't get into trouble for a bad outcome, you get into trouble for not doing something. So what that means is the science behind it frees you up to not worry whether it's your patient, your coworker, or your neighbor, and that's really important. But, you know, the Navy providers made this really important point, too. They said, it also helps with the internal liability. At least I knew I did everything that I could have. And so this is the kind of national and global common language adopted by all the federal agencies, et cetera. But why did they choose this particular thing? Why these questions? Well, it's the first time we have science-based thresholds for imminent risk. Before, we didn't know who to worry about, so the policeman had to take everybody. That person had to be put in the ED hold room. That principal had to keep that kid and send him in the ambulance. So that's really great. The other reason people didn't ask is they didn't know what questions to ask and they didn't know what to do with the answers. So every Columbia has the answers on there. The other thing, for example, is it's the first time we're asking about the full range of behavior. In the past, you would just get asked about a suicide attempt if you were lucky, and then you missed the person that bought the gun or collected the pills or wrote the note in one simple question. We were actually missing 87% of the serious suicidal behaviors that people engage in, and our science shows us that they're all equally predictive. And the final thing is that whether this is a potent language or not, we all know that having a common language is an intervention in and of itself. Just asking somebody, it builds cohesion, it builds connectedness. It literally can be like medicine. You know, the CDC tells us that connectedness is one of the most important things we need to do to prevent suicide, and having a common language is one way to build connectedness. And lest you think the importance of asking a few questions, you know, a study showed the opposite of connectedness is loneliness, is equivalent to 15 cigarettes a day, more lethal than heart disease and obesity. So asking a few simple questions to your family member, your loved one, your coworker, as well as your patient can be extraordinarily impactful and very easy. And so this is really exciting because we can all be part of the solution together. And as I said, it's a great joy for me to be here partnering with all my fellow coworkers. So thank you.
Okay, thank you. Thank you, Kelly, again for coming. And the EAP is here for consultation for any employees that ever need it. And that's a referral service, and they also have a lot of different health and wellness programs. They have meditation, they have yoga, and you'll see those announcements coming out every Friday, and I think they send it throughout the week. They also have a fitness center that's available for staff. We have to take care of ourselves and each other, and I think that's the important message here. Okay, so the next is those PDFs that come out every year. They don't change a lot every year. Sometimes they do have new things that come, but we ask that you guys review those and reference them if you need them on those topics, and they are on the ServiceNet constantly. But signing in here is saying that you understand that you are supposed to read them and know and understand what's inside of those PDFs. And we do like to we don't want to just hand you a bunch of documents and say, here, sign this. We do like to go over them and sort of review them. Two of them were sexual harassment and equal employment and opportunity, and both of those talk about protected characteristics in the state of New York. And we all are a member of several of these protected characteristics, and we all have the right to work in a workplace that's free of discrimination. Discrimination becomes unlawful, and that's, sexual harassment is one type of workplace harassment, which is covered in the EEO PDF, and sexual harassment has its own PDF. But they become unlawful if they're severe or pervasive enough to alter someone's employment. So again, sexual and workplace harassment becomes unlawful if it alters someone's employment, and New York State has a policy that says they don't have to wait for it. The 0% tolerance policy says we don't have to wait for it to become, altering someone's position before we talk to people about it. If you see it in your workplace, we want you to know how to report it. The Governor's Office of Employee Relations has asked that you report it to the Affirmative Action Officer. That email is up here, and you can also get it from your HR departments, or if you're a volunteer, you can get it from the Director of Volunteers. supervisors. You could also come to my office at any time and ask me for the affirmative action officer's email. And again, the state of New York has asked that everyone report. Supervisors should know that they need to report immediately, and even if someone has had a previous relationship, that doesn't give them the right to behave however they want and in the workplace. So we still have to be aware of that and make sure that we're reporting that if there's any harassment in those areas. Okay, so does everybody understand what sexual and workplace harassment is and how to report it? Okay, thank you. And reasonable accommodations, we got 3 different PDFs and we might get a new one. This is one that I think that they're revising this year. And we'll probably send that out and ask you guys to send us back a confirmation that you received it and reviewed it. They've been talking about releasing it since summertime. Might not come till next year, but if we do get it before the end of this year, we'll need everybody to promptly send it back, that reasonable accommodation PDF. But the 3 different areas that they talk about is the public, our responsibility to serve the public, and that includes service animals. We have a responsibility to make sure the public has access to the services that we provide. And you know, so anything that we can do, we should be looking at together as a team to make sure that we're providing those services for everyone fairly. The next thing is for supervisors and staff. That's us. You know, we actually have the right to accommodations if we need it, if you need a chair change or you need something. And typically, it's worked out with your supervisor, but if you feel like it isn't being fairly handled, you can write to your HR departments and request that reasonable accommodation. And the same with creed, which has to do with religious observances. If you need to wear something different than the uniform or additional to a uniform, if you're, you know, dietary, engineering, or safety, then, you know, they look at that. Your supervisor, again, typically handles that, determines if it's safe, and then handles it through there. That's the same for other, like religious observances as well. So employee-patient relationship is another thing that we sent out this year. We sent out the policy on this, and basically, you know, where you work sort of determines what's appropriate. You know, for, you know, if you're taking kids out in recreational capacity, it might be appropriate to take them to a movie. But if you're doing individual psychotherapy, it might not be appropriate to go to a movie with a patient. So work with your team. And we're always, you know, supportive of new innovative ideas of treatment. Of course, we're a research facility, so we should be looking at that. So, you know, if you see something that you feel is working, that could possibly work, that's different or varies, make sure you're clearing that with your team first. You know, there are some things that no one would ever do, which is, you know, engage in intimate relationships or borrow money, the things that are up here, and they're also in that policy. But then there are other things that might be different or innovative ways of treatment, but just make sure if you are doing those things that you're working with your team, talking to your supervisor, that you have those approved, and you know the expected outcomes, and you're looking at the outcomes when they're done. Okay, so does everybody, we're helping professionals, and we have to come from that perspective. And, you know, it shouldn't be exploitive at all. And that, you know, goes for research as well when we're looking at that. And of course, the IRB is looking at that as well. Okay, so internal controls PDF talks about risk management, and of course the 5 different components of risk management. I think Pete will speak to you guys a little bit about our emergency management program here as well, and they're constantly looking at that. We have a lot of committees that work on things, required skills. We are doing risk assessments in all those areas. We have cameras, which are detective and preventive, information and communication. They send out those interim life safety measures, you know, including water shutoffs, things like that. Read those emails, even if it's not in an area that you work in. You might be in that area, you know, hopefully not if there's an emergency, but in case you are, or, you know, your friends are, or somebody needs help in a particular area, you'll be able to understand and know this staircase is closed, or this area is closed off. Those are important emails that the chief and safety send out. So we also monitor risk through supervision, case reviews, internal and external audits. The Medicaid PDFs they sent out, and they did ask that like 80% of our staff look at it. So we just sent it out to everyone. We feel like it's a good way to understand program oversight. If somebody has oversight of your program and they see that there's mistakes and errors, it could start to seem like waste, or even if it's intentional, it could start to seem like abuse or fraud. So we want to make sure that we're correcting those errors immediately if we're finding them, or if we're finding them through internal and external audits, that we're doing the best that we can to make sure that it doesn't move to abuse or fraud. Okay, the Code of Ethics, people that are financial statements filers will have to do this every 3 years more intensely, and they want everybody to sort of have an idea that whether you're buying Post-its or you're hiring people or picking interns, that you have to do it fairly and with integrity, and that we're not just, buying from our friends or family or hiring our friends. And we want to make sure that it's done with the team. The team is making a decision. This is a great person. This is a good person that we could use when you're hiring. This is the best place. Of course, a lot of your choices for buying and purchasing will either go through RFMH or the state, and they'll be trying to do those, and you'll work with them together to make sure that we are doing those fairly. And that's what the Public Officers Law speaks about, as well as a lot of other things. So it's good to understand and know those. Language access, of course, this was the same this year. We do have a new telephone interpretation service. If anybody needs interpreters, make sure you're in touch with us so that we can make sure you have the right information for our account that is available 24/7 for telephone interpretation services. And we all have a responsibility to serve people that have limited English. So if somebody comes up to you in the hall speaking a language that you don't understand, take them to the safety desk and have them call us, give us a call, or they also have the number for the 24/7 telephone interpretation service. Of course, you guys know about the Zero Suicide Initiative. We spoke about this a little bit last year, but we were lucky to have Kelly Posner talk to us this year about it. If you're working on the units, we're looking for how to reduce any ligature risk. I think 75% of suicides that are on inpatient units are typically done through ligature, so we want to make sure we're reducing those risks and working with engineering on changing things out that can be a ligature risk, and we're watching areas that are as well. They also are encouraging people. OMH has partnered with a crisis text line, so a lot of people feel more comfortable texting now than they do calling. So if you want to take a picture of this, there are posters on this website. There's a lot of outreach information. Again, if people are doing safety plans or working directly with patients, even if you're just doing Hamilton Depression Scales with, as a clinical research coordinator, you may come across needing to know these things. So having a safety plan for people. Also, there's training on the CPI website on how to develop safety plans, and Dr. Posner's training on YouTube is a great one too. It's like 20, 30 minutes long. And it really talks about the questions you should ask and why, and then what you should do with those answers, or how you could work through those answers. So up next is going to be infection control, Alicia Carell.
Hello. Okay, hand hygiene. It's still the most important thing you can do to help stop the spread of infection. We refer to hand hygiene as soap and water or the alcohol-based sanitizer. Here at PI, we do use Purell. When to clean your hands, it needs to be with soap and water, of course, after toileting, before eating, and if your hands are visibly soiled. The time is 20 seconds. I know a lot of people know sing happy birthday or sing your alphabet. It's 20 seconds. A lot of people aren't washing their hands for 20 seconds. Next time, if you count, you'll see it's probably longer than what you've been doing. And the alcohol-based sanitizer, just rub until dry. So before and after patient contact and after removing gloves, you can use the Purell or soap and water. We have posters in the bathrooms. If anyone sees any bathrooms that don't have a poster up or something, let me know. We can get one in there. And we do have, especially I know on the inpatient units and out in the clinics, we have to have hand hygiene monitoring that's done. And we need to, this is a Joint Commission requirement that there are reports done and compliance rates and things like that. Measles. So measles, of course, is in the news. The questions I get, all workforce here have proved they are immune to measles. the CDC says you prove immunity either by your medical record of your 2 MMR vaccines or a titer. And immunity is lifelong. There's no booster that's required. So all this workforce are immune. The only question would be for patients or if there was a visitor. So of course it has fever and rash. It is highly contagious. It's airborne. If there was a patient which you suspected of possibly measles, you would put a mask on them, put them on isolation, and they're to be transported over to the ER. You always want to alert the people who are transporting and on the receiving end that you're suspecting measles. Occupational exposures, so any needle sticks or splashes to your eyes or cuts or anything like that, what you want to do is always clean the area first, okay? Wash well with soap and water. A lot of the treatment rooms and lab areas have eye wash stations to flush your eyes. Let your supervisor or the person you know that you've had this accident, and then you can contact me, or I think usually what's the fastest and best way is on your yellow card, there are emergency numbers. My email is there, but there's always a nurse on call with a beeper. So if you beep the nurse on call, they can help facilitate the steps of what needs to be done, and certainly if I'm here, they'll notify me right away to come over. So if you know where the source is from, if it's a patient and there, don't let the patient go, okay? Because we will ask them to do rapid HIV testing and send off hepatitis labs stat, and that is going to help in identifying what your risk is. If it's Monday through Friday, 9-ish to 5-ish, you go over to Workforce Health and Safety, which is on the first floor of Harkness Building in Presbyterian. If it's off hours, you go to the emergency room. So what you want to get as much information as possible with what your risk is, and then nobody will make you do anything, but they're going to help evaluate what your risk is and make a recommendation. If the recommendation is to take the prophylactic medication, it is best if it's started just within a couple hours after the exposure. There is an accident report online on the ServiceNet. It's on the right-hand side, accident incident report, and it's an online entry form if you would complete that also, and then we'll follow up. You know, people don't get in trouble for exposures. What we want to do is just to see, is there something that we could be putting in place to make it safer, so to decrease the chance of it happening again. Waste. So sharps containers, red bags, or regulatory and regular trash. Of course, sharp container, everything that's sharp goes in the sharp container. What would cut the bag? So needles, glass slides, and we put blood tubes in the sharps containers. For red bag or regulatory waste, there is a tremendous amount of unnecessary red bag waste used in the clinical areas. If you see what goes in red bag waste, it's basically soaked, caked, or dripping with blood or body fluids, but doesn't include urine, fecal materials, unless visibly contaminated with blood. Okay, so if it doesn't fit into those categories, it can go in the regular trash. And regular trash, the plastic bags. On the inpatient units, we have paper bags for patient safety. Universal precautions, or PPE, personal protective equipment. So these are, whenever there's a chance of coming into contact with blood or body fluids, always wear gloves. As soon as you're done with the specimen, what you're working with, you remove the gloves, you clean your hands. Don't wear gloves out in the hallway or in the elevators or anything else. The gloves should only be used when you're working with the specimen in the lab area or with the patient. If you're pipetting blood, you should be using goggles. Eyeglasses are not sufficient protection. And super Sani-Cloths, these are those white, the containers that are white with the purple tops. These basically are so good for cleaning everything. So a lot of the viruses can live up to several weeks outside of the body on counter space or wherever in microscopic amounts. And just even for colds and viruses from colleagues around here. So anything you want to clean your area, clean your keyboard, clean your desk area, and certainly anything that comes in contact with a patient is supposed to be cleaned in between use. So blood pressure cuffs, EKG leads. If the patient is on the exam table, anything like that, please clean after. Joint Commission is over, but one of their favorite questions is what the kill time is, and that refers to how do you know the product is effective, and that's 2 minutes. It means that the product is supposed to remain wet for 2 minutes, and if not, you would reapply it. TB testing and flu vaccine. So we started flu vaccination, and I'm doing it a little bit differently this year. I'm starting with the inpatient units and some specific department clinics. We've been to a lot. We have a lot scheduled. And then after that, starting October 15th, I will have open flu vaccine clinics in the Kolb lobby, and that'll be for the 3 weeks in October. We'll send an email out with exact dates and times. TB testing, there has been a shortage of the Tubersul, the TB testing solution that we usually use. And so right now the TB testing is on hold. We do have a different product, but it's not clear whether we should go to that or see if we can still get the one that we had been using. So there's currently no TB testing. Hopefully that'll change and we'll get going again with that shortly. But flu vaccination. We'll have, again, a lot of clinics and then out in the Kolb lobby and starting October 15th. We do need to, compliance, with the flu vaccination, we have, there actually are lists of everybody who has taken the flu vaccine or has refused the flu vaccine. And I have to report these lists to Albany, to OMH, and then looks at a certain amount of what percentage is compliant. If you have your flu vaccine or your TB testing done here, we could give you a copy of your medical record, but you need to request it. It's not automatically sent, but what works best is you send me an email, and then I can reply with an attachment of your medical record. Because a lot of people are also over at Presbyterian or with the university. All right, so just to summarize, wash your hands, clean your hands, wear personal protective equipment when needed, always act immediately if there's an exposure, put sharps in the sharps containers, garbage in the correct trash area, clean your area, clean everything that comes in contact with patients, and take your flu vaccine. And hopefully we'll start TB testing shortly. And if you really are sick, it is much better to stay home than come to work and infect your colleagues around you. If anybody has any questions or something comes up, or again, my office is here in this building in the nursing administration suite on the 6th floor, but probably the best way to contact me is by email, and my email is on the back of the card here. Thank you. Who's up next? Yeah.
Okay, so up next, Chris Stanley prepared a video about cybersecurity for us here at the Institute.
For the next 10 minutes or so, we'll look at some of the most basic data security principles and practices that apply to nearly all of us as members of the NISP workforce. While we'll focus heavily on healthcare data, that is data protected by HIPAA, the principles here really do relate to all information we handle. Anything that we don't want to see in the New York Post needs to be protected. Details on nearly all these topics are available on the Psychiatry intranet site, psyit.nisp.org. So, let's begin.
HIPAA regulates how we collect, use, and store data here at NISP. The goal of this presentation is to give you an understanding of the privacy and security rules put in place by HIPAA, and also to provide you with the information about steps you can take to keep information secure. HIPAA stands for the Health Insurance Portability and Accountability Act. The original law was enacted in 1996 and was intended to establish national standards for the protection of health information. Subsequent additions to the original law have been aimed at regulating the use of digital medical records. There are many components to HIPAA, and the actual laws can be pretty complex. For our purposes, we will just be going over some specific components that directly affect how we operate at NISP. This video is only intended to go over the most relevant aspects. The first thing we will cover is privacy. It applies to protected health information, or PHI, created, used, or disclosed by a covered entity. The privacy rule establishes who is permitted to use, disclose, or access information. It also requires that only the minimum necessary information be used for any permitted action regarding PHI. The privacy rule protects all individually identifiable health information, held or transmitted by a covered entity in any form or media. Individually identifiable health information is any health information for which there is a reasonable basis to believe it can be used to identify an individual. PHI is comprised of health information and personal identifiers that link it to a specific person. This is a list of common personal identifiers. If any of these are linked to health information, then it's protected health information. Now let's look at the term covered entity. A CE is any organization that is subject to the privacy rules established by HIPAA. All students, interns, registered volunteers, staff paid by OMH, Columbia University, or RFMH, or others that work in some capacity under NISP or OMH are considered part of the NISP workforce and must comply with HIPAA regulations. A business associate is a person or organization that provides a service to a covered entity involving access to PHI. The privacy rule requires that a BA contract include specific safeguards in place to protect PHI. A business associate contract is not required for disclosures from a covered entity to a researcher as long as patient authorization has been obtained. A CE can use and disclose PHI for treatment, payment, or healthcare operations without written authorization. Any information disclosed must follow the minimum necessary rule, which states the use of the minimum amount of information necessary to achieve the intended purpose. HIPAA is not the only thing to consider in terms of protecting patient information. There are also New York State and Columbia regulations that apply to specific situations. The ones listed here are just some examples of additional laws that protect patient confidentiality. Contact the HIPAA officer to find out specific laws regarding your specific research information. All the different elements of patient privacy can seem like a lot to remember, but there are a few simple things that you can do to ensure that patient information is not accidentally or carelessly disclosed. Remember that most parts of the privacy rule can be accomplished by using common sense. Don't discuss PHI in any public place or with people who are not authorized to have that information. Avoid using patient names in public areas. Don't leave labeled patient specimens visible in unlocked boxes. Also limit the physical access to areas where patient information is kept. Do not leave identifiable information on voicemail or an answering machine unless you know the machine is secure. And send PHI in sealed envelopes that do not have NISP in the name on the address. Now let's look at the security rule component of HIPAA. The convenience of electronic patient information comes with an increased risk that information could be stolen or accidentally disclosed. In recognition of these risks, HIPAA includes the security rule, and it applies to PHI stored or transferred in electronic devices. Security rule requires an institution to have policies and procedures to manage the selection, development, implementation, and maintenance of security measures to protect ePHI. Now let's look at how we here at NISP comply with the security rule. This section will also include some New York State required information security. In order to comply with federal, New York State, and Columbia policies, NISP has established these password requirements. All passwords will expire every 180 days. You will be automatically prompted every 6 months to create a new password. New passwords cannot match previously used passwords, and passwords less than 2 days old can only be changed by an administrator. Finally, passwords must be at least 10 characters long and contain characters from 3 of the 4 listed categories. Keep in mind that 10 characters is only the minimum, and you are strongly encouraged to create a longer password. There are a few things you can do to make a strong password. First, don't reuse the same password for every account that you make online. This is especially important for things like banking services and your email accounts. Avoid using personal information. Things like children and birthdays make terrible passwords. Most importantly, longer passwords are significantly more secure than short ones. Consider using a passphrase instead of a password. Federal recommendations for account security encourage the use of passphrases that contain a series of words that make sense for the user but wouldn't be obvious to anybody else. Consider this example. The phrase sun, walk, rain, drive is easy to remember and can serve as the basis for a strong password. We take this phrase, apply the NISP required uppercase letters, numbers, special characters, and use a little bit of imagination. We get a strong, compliant password that you can be proud of. Only authorized users should have physical access to NISP devices or personal devices that access PHI. Never leave a laptop or mobile device unattended. When traveling, any electronic device that can be used for NISP business should always be secure. They should never be in checked baggage. Users with mobile devices containing or accessing PHI must make sure that data on the screen cannot be seen by unauthorized persons. This leads us to the next section, the proper encryption of devices used at NISP. Encryption is a method for protecting data from people that you don't want to see it. While there are many methods of encryption, they work in the same fundamental principle. Data is scrambled using an algorithm and unscrambled with the use of an encryption key. Encryption is an effective way to keep data secure. It's also very easy to take the basic steps necessary to ensure that you are correctly encrypting any device that you might use. There's really no excuse for storing plain text data, be it PHI or otherwise. Data security is generally broken down into two categories. Data at rest refers to inactive data stored physically in any digital form. This includes databases, spreadsheets, and archives. Data in transit refers to data actively moving from one location to another, such as across the internet or through a network. Encryption is required for data at rest in regards to desktops that access or contain any state entity, personal or private or sensitive information, data stores containing PHI or NISP information, any mobile device, state-issued or personal, used to access any state entity information, and all portable devices containing state entity information. Encryption is required for any transmission of personal, private, or sensitive information when connecting to the state internal network over a wireless network and remotely accessing a state internal network. Detailed instructions for the proper use of encryption can be found on the Psychiatry website. iPhones and virtually all Android devices have built-in encryption features. You need to check your phone settings to make sure you are taking full advantage of these features. Your phone should be password protected and set up to have screen lock after 5 minutes of inactivity. Your device should also be set up so that all data is wiped after 10 incorrect password attempts. There's more information regarding mobile device encryption on the Psychiatry website. The loss or theft of any device containing NISP data must be reported immediately. NISP uses Office 365 as a secure email service for all its business. You should never use a personal email for anything involving PHI or any other NISP-related business. You can encrypt emails in Outlook by including the hashtag encrypt in the subject line. You should also include this disclosure when sending PHI within an email. Responsible use of email is crucial for keeping our network free from viruses and malware. Here are a few things that you should keep in mind. Phishing scams typically ask for personal information from people through fake emails that appear to be from legitimate sources. Psychiatry will never ask for your password or personal information via email. Treat any email asking for personal information as suspicious. If you're unsure if an email is legitimate, please contact IT for assistance. You should also not open any links from sources you do not recognize. This applies to Mac users as well. No system is immune. Please notify the service desk if you have any reason to believe that your account has been accessed or you suspect that something may have happened to compromise your device. Psychiatry requires that all systems be registered. The last part of HIPAA covered in this video will be the breach notification rule. A breach is a prohibited use or disclosure of unsecured PHI under the privacy rule that compromises the security or privacy of the PHI. Any breach is thoroughly investigated to determine the nature and extent of the information disclosed. Steps must be taken to minimize security risks, and all patients affected by the breach, regardless of the quantity, must be notified. There are specific penalties in place for failing to protect PHI. The penalty amounts are based on the level and intent of the breach. All accidents are classified and penalized according to their type. Examples include faxing or emailing a document, sending lab results to the wrong person, using PHI without proper security credentials, or failing to encrypt a mobile device. These are a few examples of how a breach might occur. All workforce members in NISP are required to understand the privacy, security, and breach notification components of HIPAA. PHI and ePHI must be protected. In order to make it easier for employees to comply with data management policies, Psychiatry recommends the use of specific applications. Detailed instructions for each of these services, along with a more comprehensive overview of features within those systems, can be found on the Psychiatry website. If you have a specific need that's not covered, contact IT support to inquire about additional possibilities.
Thanks again for your time and attention. And for more information, please check out our intranet sites or email Psychiatry.
When I was preparing for this year's presentation, I spoke with some of the other presenters, and we all agreed we were going to keep it short because there's no Joint Commission year. Joint Commission deals with the safety of the patient. There's no ALAC this year. ALAC deals with the safety of the animals. So I said, well, you know, before I make the presentation, I'll go over some of the data, see if there's a rise in thefts, slips, and falls. I know one year we had about 35 thefts by this time. That's not the case this year. Another year we had bunch of slips and falls by this time. That's not the case this year. Another year we had about 7 fires, so we didn't have that this year. So I said, it's not a lot to talk about, so I'll keep it brief. So we had a pre-meeting with the presenters, so everybody brought their presentation and showed it. So I came with 2 slides. So everybody was like, well, wait a minute, where's the rest of your presentation? You left out your presentation. I said, that's an introduction to a presentation, but presentation doesn't have 2 slides. You got to go back and work on your presentation. I says, no, that's my presentation. It's going to be 2 slides. But these 2 slides are going to just basically talk about, we could apply it to security, safety, fire safety, because it's about communication. Just tell a story, something that happened middle of the summer this year. I was over by the annex, and an employee came running up to the annex to me, and he says, you got to come into my floor. I got a flood on my floor. You got to hurry up and come up to the floor because it's a serious flood. Call for assistance. So I says, well, all right, I'll send somebody up there. I'll call the maintenance department. We'll call the environmental services, housekeeping. They'll come and they'll deal with your flood. So he left. 5 minutes later, he came back. Well, where's everybody? There's a serious flood on my floor. Somebody's got to come up there. This flood is terrible. You got to come. I said, look, is anybody injured? No. Well, you know what? Someone will go there, and they'll deal with the flood. So he went in the elevator, came back down to me. He's like, look, you've got to come and deal with this flood. This flood is terrible. You've got to come and see this flood. It's a terrible flood. So I'm like, okay. I get on the elevator. We get on the floor, and I get outside. Holy! He said, exactly. That's what's flowing all over the floor. The toilets are overflowing. They got to deal with this situation. So I said, look, I got on the radio. I said, look, call my staff. So you guys got to come here really quick. There's a terrible flood on the floor. Come up here immediately. So a couple of minutes later, nobody come. I get on the radio again. I says, look, you guys got to come immediately. It's a terrible flood. So they get off the elevator, and they're like, holy. I said, exactly. That's what I was trying to tell you guys. Well, why didn't you say it over the radio? I said, I can't say that type of, I can't speak that kind of language over the radio, but you guys have to deal with it. I said, we have to set up a perimeter because no one could fall in this. No one could fall. So we set up wet floor signs, so staff were coming by. Everybody had their cell phones. So you do not want to step in this. Look down. So they were like, oh, I said, exactly. You don't want to step in this. Walk around the perimeter. Make sure you don't fall. So we set up a perimeter. I'm telling you, the smell it was July, so the smell was unbelievable. It was overflowing. So I called my staff downstairs. I says, look, where's maintenance? Where's housekeeping? We really need people. They said, we called. I said, did you tell them what's flowing? They said, well, I can't use that kind of language over the phone. No, I'm giving you permission. I'm actually ordering you. Tell them exactly what's flowing and be direct. Let them know. So he called, let them know what was overflowing. So maintenance, housekeeping came off the elevator. So they came off the elevator. They were dealing with the flood. So it kept flowing. What we found out later was that we put up signage on the bathroom floors, and more flow was coming, more flow. People were contributing to the flow, we found out. People were still using the bathrooms. The flow was coming. There was fresh contributions to the flow every minute. So we had to send people around and lock the bathroom so we didn't have fresh contributions. So, I was standing there, and, we had the plan set up. We kept people from falling, but all of a sudden, out of nowhere, I heard a splash. So now, usually July, a splash is a beautiful sound. If you're at a swimming pool, it's beautiful. If you're at the beach, it's beautiful. But when that's flowing down the hallway, that's not a nice sound. So I was scared to look. So I was looking, and then I sensed somebody was right behind me. And I was scared to look back. I looked, and he was like, what is this? I think he knew what it was. And he was angry. So I said, let me calm him down. So I just said, at least you're not hurt. I was going to say something like this happens every day, but it doesn't happen every day. That never happened before. But nothing I could tell him could calm him down. He says, I need some clothes. I have a bunch of meetings today, and look at me. So I said, you know what? All right, we'll see if we can get you some clothes. But you're not hurt. So I came back downstairs. When I came downstairs, I looked at the ceiling, and I said, oh, I hope that's rust. I hope that's rust. It was starting to flow down into the plaza level, right by the ATM machine. So I told my staff, let's get some caution tape and seal off the ATM. So we sealed off the ATM. I went upstairs to see if they had stopped the flow. When I came back downstairs, someone had tore down the caution tape, and they were using the ATM. And I says, Miss, do you know what's flowing above you? She says, I don't care about that. I got bills. Stand back. I'm using this ATM machine. So we had to actually post somebody in front of the ATM machine to keep somebody from using the ATM because people were still going from, Presbyterian. I guess it was their payday. Staff were flowing in. They were going to use that ATM no matter what kind of caution tape we had up. So we put staff up there. So when I went up to the floor, we made announcements, told staff what was going on, that they had to use the code, had to use the Parties building. So we went up to the staff. They had stopped the flow of the floor, and housekeeping, they were cleaning the area. So there were actually some takeaways from that whole event, that messy event. And one takeaway is it's important to call 5555. Now, that staff in that situation, he did the right thing. He told me directly, but in other situations, sometimes people call 5100. It's important to call 555 for everything, medical emergencies, security emergencies, psychiatric emergencies. 5555 is the number. Another takeaway is, make sure you give your name, exact location, and type of emergency. And details are important. In this case, the details was the whole key. A regular flood compared to what was actually flowing was the key detail that made the response. It's the same thing with a medical situation. Sometimes somebody will say, I have a staff here, and we get to the location, that person wasn't conscious or outpatient. So that's the key thing. If you say something like that, we'll activate the medical emergency plan. So it's very important to give details of exactly what happened. Also, be available for follow-up. You're the key. If it's a medical incident, you witnessed the person become unconscious, or if you're a victim of a theft, you're the person who was the victim, or a chemical spill, you know the chemical, so it's very important to be there to assist with follow-up. Also, complete any accident reports. It's very important that you complete that accident report. In this case, with the person who slipped and fell, at the time he said he was embarrassed, he just wanted to move on, but he actually sprained his arm. He went over to the urgent care and had a sprained arm, and later filled an accident report. So that's why it's very important. If you have an accident, even if you slip and fall, subject or patient slips and fall, make sure that person documents it in case that person is injured and finds out later. Also, make sure that you read signs and follow signage. What happened with that case, people weren't following the signs we had up on the bathrooms not to use it, and was making the situation worse. It's very important to read the signs. A few weeks ago, we had a repair in the garage, and we had signage that we're exiting only on the outbound side and entering on the outbound side. And so we redirected traffic, and I was standing in the parking garage, and people were going in and out the wrong way. Even though we had signage on the elevators, but we're busy. A lot of times we don't read it. A couple of years ago, I was watching on Channel 13, at this documentary where they were talking about the renovation of St. Patrick's Cathedral. So they had the safety director there. And he was talking about the challenge wasn't keeping the workers safe, it was keeping the visitors safe, the New Yorkers who were passing by the cathedral safe, because they had all types of signage and people weren't paying attention to signs. They were going over the barriers, under the barriers. Like you said during the documentary, that New Yorkers are incredibly brave and in a hurry. So normally he would be afraid to do something. New Yorkers will go under something, go over something. They don't care because they're brave and in a hurry. So I thought it was just a PI, but actually that's how people are here. So that's why it's important. If you see signs, please take time to read the signs on the elevator, especially if it has to do with your safety. Same with an email. You see an email, please take time to read the email. And also listen to announcements. Very important. Sometimes you're busy, it's difficult to hear, but take the time to listen to announcements, especially during an emergency situation. But that's it. I said I would be brief, and I was brief.
Good afternoon, everybody. I'm Peter Reynolds. I'm the NYSPI Emergency Management Coordinator. Today, my topic is going to be more about emergency preparedness. Weather is our #1 concern. Obviously, flooding. We had these coastal storms coming up the East Coast, these hurricanes that were down in the south and coming up the East Coast. We were actually monitoring it and being prepared and doing what-ifs. I know we're all enjoying the nice weather, but this is coming. So just so people should be prepared now for the winter, snow, ice, slips, falls. If you have a home and you have a boiler, it's a good time to get your boiler prepared for the winter. This photo here is New York City on this summer, It's Saturday night, July 13th, when there was a blackout, loss of power in Midtown Manhattan. And so people preparedness, what to do when the power goes out in a large area like this, utility failures. September was National Emergency Preparedness Month, and I'm going to give a little bit more about preparedness in a little bit of my speech. October is National Fire Prevention Month, and as a volunteer firefighter, I recommend all of you to test your smoke detectors and CO detectors in your home, change the batteries when they change the clock, and the other thing, if they're more than 5 to 7 years old, throw them away and get a new one. This is an overview of NYPI's emergency management program. Every hospital in the country is required to have an emergency management program. It's a big topic for the Joint Commission when they actually reviewed it last year or this year. And there's like 50 standards that we need to meet, and we did very well in our Joint Commission review. We do have a multidisciplinary emergency management team representing all the different functions within the facility, and we talk about our risk preparedness and what we need to be prepared for. Our incident command center would be the conference room right behind this auditorium in room 1602, and that's where incident command would be set up to address any types of emergency situations. We do have a backup on the 3rd floor of the Colbanics. Every year we do a hazards vulnerability analysis where we identify our risks from the last couple of years. We also don't do it for NYPI, we do it for the complete medical center. So we do it with Columbia and Presbyterian Hospital. We do have an emergency operation plan. We're required to have an inventory of resources, supplies, materials to sustain us for 96 hours. Training of the staff. This is an overview for general staff, but the emergency management team, administration, safety department has a little bit more in-depth training. And we do drills and exercises. And of course, communications is one of the major keys to any emergency preparedness plan. We do include all the programs within the facilities, obviously our clinical care, both inpatients and outpatients, the education program, obviously research labs, our animal research, our hazardous materials, all of our laboratory samples are included, our cell lines. Again, IT and data, communication systems. Our utility systems has redundancy systems on our heating, air conditioning, our water lines, our water services, our utilities, and we do have an emergency generator. And we don't do this alone, we do this with community partners. This is some of the highlights of our hazards vulnerability. Obviously, extreme temperatures is always a concern. Several days below 15 degrees or above 95 puts a tremendous stress on us as humans and also on infrastructure. We're always preparing for the flu. Extreme weather, blizzards. It seems like the last couple of years we've been having a blizzard either in January or February for the last 5 years. Always the risk of hurricanes. We know the results from coastal storm Sandy. We're concerned about transportation interruptions with the MTA. 85% of the staff that work here in NYPI come by mass transit. So if there is a mass transit emergency or a shutdown, it will affect our pattern, our staffing patterns or our staffing requirements for NYPI and the entire medical center. I mentioned utility failures, both internal, local to NYPI, and also the external ones. Always concerned about fire. Psychiatric and medical emergencies is on our risk. Mass casualty incident, it's more from the medical center standpoint. In the event that there was a mass casualty incident in upper Manhattan or in Manhattan anywhere. And so we do prepare with Presbyterian Hospital and the university. We do have labs with chemicals and radiation, and we're always concerned about an active shooter incident. As I mentioned before, community partners. We do this with OMH Central Office, and there's 5 OMH facilities in New York City, so we do have a memo of understanding with each one of these 5 other facilities. I already mentioned Columbia Presbyterian, but we also include our first responders, FDNY, the police department, Office of Emergency Management, Department of Health, and the Department of Environmental Protection. So together we plan, we train together, and we prepare a response in the event of an emergency. NYPI is part of this program from the New York City Office of Preparedness, New York City Office of Emergency Management, Partners in Preparedness, where this is part of the program, to talk to you as staff to really encourage you to have an emergency management and a preparedness plan at home for you and your families and extended families. All of us, a lot of us now are taking care of our parents. We need to include them into our programs. So I'm going to show a short video.
Text on screen. Ready, New York. What's your plan? A well-planned escape. Patricia speaks to us from a dark room.
It was one of those real hot nights in the city. The street fence was steaming and it felt like everything was just going to melt.
Flashback to Patricia in her kitchen.
I had gone into the kitchen for some water when I felt the whole building shift under my feet.
She puts the glass down and grabs her walker.
I noticed a large crack in the wall, and I knew something was very wrong. The first thing I did was call 911.
She talks on the phone.
The operator told me that there may be a structural problem with the building, and that I should evacuate if I didn't feel safe, and that I should not take the elevator. That was easier said than done for me. Without my walker, I can't really get around. The only way I was going to get down those stairs was if somebody helped me. The 911 operator told me that the fire department had been dispatched and that emergency workers would be coming.
She hangs up.
But I felt like I was in real danger and that I should get out. I started to panic a bit. And then I thought, Patricia, get a hold of yourself. You've made plans for these kinds of emergencies. Just follow the plan, and everything will be okay.
Flashback to Patricia preparing her emergency plan.
One of my designated emergency contacts is my neighbor, Tori. She has a spare key to my apartment. Tori knows how to help me get downstairs with my walker. We had already made arrangements for her to check in on me if there was ever an emergency, so by the time I got her on the phone, she was on her way to my apartment.
Tori hurries down the hallway towards Patricia's apartment.
I put my cat Charlie into his carrier, which holds not only him, but all of his supplies.
Tori opens the door with her key.
When Tori got to my apartment, I grabbed my medications and my go bag, which I keep by the front door, and we headed straight for the emergency stairs.
Tori grabs the go bags and the carrier.
It was slow going in the stairwell.
Tori helps Patricia down the stairs slowly.
But eventually, we made it to the street.
They exit to a busy street full of first responders.
The scene on the street was chaotic. The entire building was being evacuated because of a structural problem.
Onlookers are herded away.
A young lady that I recognized from the building waved me down. She and her mother don't speak much English. She was alone and pretty scared when I saw her. I asked her about her mom, and she pointed back up at the building with a nervous look on her face. That's when the firemen started asking her questions, but they were having trouble understanding each other. Tori had stepped in to try to help when the young lady pulled some index cards from her backpack. The cards were full of important information written in simple English. One of the cards had contact information for her aunt, and we were able to give her a call. I told Tori that Susie needed more help than me, so Tori promised to stay with Susie until her aunt arrived. I also ran into my neighbor Richard, and he looked so worn out. He didn't have a bag pre-packed for emergencies, and because everything was such a rush, he didn't have time to grab any of his medications.
Richard sits receiving medical attention.
Poor Richard had to borrow my phone to get in touch with his family and his doctor. He can't afford to miss taking a dose of his heart medication. He seemed so shocked and angry that this was happening to us.
Richard speaks on the phone.
You know, you never want to believe it's going to happen to you. But when you really stop to think about it, emergencies happen all the time in the city. It's not a question of if. It's a question of when. The only thing you can really do about it is to prepare yourself.
Patricia uses her walker and goes down the street.
My apartment is my family's meeting spot in emergencies, but obviously that was not going to work out. But we have a backup location, which is the public library, a few blocks away.
She sits on the steps of a library.
In the end, I was okay because I was prepared.
Her son comes to meet her.
I have a network of family, friends, and neighbors who provide me with support. And together, we follow the same plan to make sure that we are able to communicate and to regroup. Being ready for emergencies can be a matter of life or death. Not just for someone like me, but for everyone. I don't know about you, but I still have a lot of living left to do. So I'm going to stay prepared.
I know we all get complacent and we say it's not going to happen to us, or it's not going to happen, we're not going to be included. But I think Coastal Storm Sandy, when it hit New York City, really alerted a lot of people, and many of us have already forgotten about what the impact of Hurricane Sandy is. So I really suggest have a family plan, be prepared. If you have to evacuate, know where you got to go ahead of time. You really don't want to go to a shelter if you have to. You really want to go someplace that's safe with a family or friend. These are just some pictures of our NYPI's emergency management program, go bags, response bags, water, communication cart, some of our stuff that we used at some of our health fairs here. This is a new flood zone after Sandy. If you are a family member, live in zone 1, 2, or 3, you should really be prepared to evacuate in the event of a major coastal storm. These are just some websites. If you live in the 5 boroughs, this is the New York City Office of Emergency Management. I really suggest that you take a look at it, get familiar. This is our website. Again, wherever you live, whether it be Westchester, Long Island, New Jersey, please find your local website for emergency management. There's a lot of good information. And in closing, have an emergency plan at home and at work. Be safe. Thank you.
Hello, everybody. My name is Matthias Quick. I'm the Director of Lab Safety, and I'm talking to you about Right to Know. So the Right to Know is a law, and you have the right to know about the hazards you may be exposed to and how to protect against those exposures to those hazards. It's not only for lab staff. This is for the entire institute. And for example, it's not just the chemicals in the lab that are hazardous. Also, chemicals that are in household cleaning items is a danger. So what does the Right to Know law say? There has to be Right to Know posting. There has to be new employee training. There has an annual refresher training for Right to Know. And welcome, you're just having it right now. We have to maintain the exposure records if there's any incident. And also, we have to provide the safety data sheets or the SDS within 72 hours upon request. And who do you ask if you need those safety data sheets? If there's an inspection by the EPA or DEC, DEP, if there's an inspector coming asking you, where would you find the SDS? The answer would be, I talked to my Right to Know officer, and this is me. So at any event, if somebody is asking you, come to me, and I provide you with those sheets within not 72 hours. I'm trying to do this in 72 minutes. But if you want to look up the information for those safety data sheets yourself, you can go to the internet, go to ServiceNet, NISP.org. And on the ServiceNet, you find on this link for employees, this link that guides you to the Right to Know law. The first part talks about the right you have to know about compounds in your institute. And then if you're looking for the safety data sheets, there are 2 links here. The top one is for safety data sheets used in different departments like housekeeping. The lower part here links you to a website called ChemWatch, and in ChemWatch you find every chemical that's commercially available. And if you have any question, this is the way you go. So if you start working with a chemical or with a potentially hazardous substance, you can go there and check out what the dangers might be. Excuse me. So the chief mentioned science being ignored. There's a special term in the chemical world. It's called hazardous communication. And all these signs indicate the hazards you may be exposed to. So unlike you heard in the chief stories, don't ignore those signs because it may be, unfortunately, the last time you may ignore these things. So if you see a lab door like this and you see those signs on the door, that means stay out unless you're trained to go into those labs and have the proper training to handle chemicals, radiation, lasers, and whatnot. This is the way you should go in, otherwise stay away. Alicia mentioned the training, the separation of sharps. So if you have regulated medical waste that's really infectious, you should go into a red bag. If this item could puncture the bag, it should go into a sharps container to prevent any injuries, because you don't want to touch anything or being have a needle going through your hand that was used for any virus work. So make sure that you actually separate the waste to the best of your knowledge, making sure nobody's getting injured. Chemical hazardous waste is disposed in the labs, and there's a certain way of doing so. Those containers have to use those orange labels, and you have to list what's in them. The same goes for radiation waste, but there's another line of waste, which is universal waste. So batteries go into this universal waste. There's e-waste, laptops, computer screens, batteries, and also fluorescent light bulbs. Also used oil, so if you work in an environment like in a lab, there's a compressor or something that has used oil, just don't dump it down the sink. There is a used oil collection point here in the Institute. So if you're unsure how to use this, reach out either to me or to engineering, they will help you. Hazard management, so in the case of a spill, there are two ways of spill responses. One is the spill that can be managed, and the other spill can be managed by yourself. If you're trained, if you have the proper training for lab personnel, you may be able to contain the spill and clean up the spill. If you're not trained, or if the spill is so dangerous and you know what it actually is, it becomes unmanageable for you. At this point, stop work, alert potentially exposed lab workers so they're not exposed to the chemical there. If possible, contain the spill. If necessary, evacuate the area. Notify your supervisor and NISP safety, 5555. And this is the same set as the chief mentioned. In case of emergency, don't walk away. Inform people, call 5555. Do not call environmental health and safety. When you call the safety desk, they will inform EH&S and coordinate the response. As I mentioned, don't walk away. Assist in the response and the cleanup. Even though you just walk by and see this, it wasn't you who caused the spill, but if you see something like this, don't walk away. Alert 5555 and inform them when you saw this incident, if you saw something else, to get information about what this actually is that's on the floor and may endanger the environment here. So if possible, assist in response and the cleanup, and if you need medical attention, go to your occupational health services or the emergency room. And also, as the chief mentioned, file an excellent report. It's always important to follow up, because this may happen once. We try to prevent this for the next time. Any questions for Right to Know, chemical, hygiene, safety, please reach out to me. Here's my phone number. You can come to my office, or if you see me in the hallway, talk to me. Information is on the service net. And again, the main emergency number, no matter if it's a medical emergency, a chemical emergency, hazardous compound emergency, call 5555. Thank you. So.